If you're having back pain in the middle back, I'm going to show you some techniques you can do to try to decrease your back pain and improve your mobility. So our first technique that we're going to do is going to be a gentle thoracic mobilization. This is going to be a grade 4 mobilization. So you're going to have the patient lie down on their stomach like this, as far as arm placement, just whatever is comfortable. There are different mats and mat tables that can accommodate the arms in front or the side. Just whatever you have works just fine. And so what we're going to do here, I'm going to go into Kinsley and the thoracic spine here. I'm going to cup my hands kind of like this. If you can see, this technique I really like. It's just a personal preference of mine. I'm going to go on both sides. I'm going to find that spinous process, that part of the bone that sticks out right there down the center of the spine. I'm going to go on both sides. Now, normally I would have a table that's lower, so this is a little high for me. But, just for our purposes of the video, so you can see, the table is going to be a little higher. She's going to be a little higher up. So I'm going to take my hands like this. I'm going to go right at the top of her thoracic spine. So what you can do is find that CT junction, that cervicothoracic junction. That's that kind of hard knot area that you're going to feel in the lower cervical spine. So I'm going to go just below that. I'm going to cup my hands like this. I'm going to ask Kinsley to take a deep breath in. Usually do this a couple of times. She's going to exhale. She's going to go all the way out. Exhale. And I'm going to ask her to take another deep breath in again. And then she's going to exhale. And as she exhales, I'm going to push down kind of at an angle up towards her upper chest. And I'm just holding that. I may oscillate it for a few seconds there and then relax. Let her breathe again. And then every time that she goes on the out breath, I'm going to kind of lean in, hold that pressure, and stretch the joints. I may oscillate, back and forth. Again, you don't want to do this too long. You're going to make sure you give them time to breathe. And she's going to come back out of that and then go back down again. And I just repeat that and kind of work all the way down the spine, in the thoracic spine, to around, lower thoracic spine. It's very difficult to do that technique at, T10, T12 area, just because of the angle and all. For me, it just is a little more difficult. So I like that technique for the upper thoracic and middle thoracic areas. And we can also do a rib springing technique where kind of go in and I'm going to crisscross my hands like this. Same thing, she takes a deep breath in, and then as she lets out, I'm going to come down. Now with this, I have my hands a little farther apart off of the vertebrae a little bit, so I can try to capture the ribs a little more. And with this, is any technique that you're doing, especially with the spine, for me it's very difficult, and I think a lot of research supports it's very difficult to be super specific to an exact level. I know there are practitioners out there that can do that, but for me, just globally, I'm just kind of going in the general area. And so I'm going to do that technique. I will start that using mid-thoracic spine, and then I'll work down to lower thoracic spine. So she's going to take another deep breath in. And then as she lets out, I'm kind of rotating my hands around on her ribs a little bit. I may spring, 2 or 3 times, kind of a little bounce there, and then let her breathe again. You can take that into a manipulation if your scope of practice allows for grade 5 mobilizations of manipulation, so you can do that as well. But for a lot of patients, especially if they're apprehensive of having their back popped or adjusted or manipulated, or again grade 5 mobilized, whatever your profession is, then you can just go in just gentle with those grade 4 mobilizations, that stretching the joint capsule, and that does really well. And the techniques that I like. And one of the other ones that I like to do also is going to be, we're going to come from the other side. And so same technique, I've got my hands kind of cupped like this. I'm going to go at the upper thoracic and this CT junction right here, and I'm going to push in and down. We're pushing down towards her stomach there. And same thing, she's going to take a deep breath in and she's going to let out. And as she exhales, I kind of push in there. I may oscillate that, a few times, and then I work my way down with that. That technique going from superior to inferior, with that I don't typically go past middle thoracic spine just because it gets a little difficult. Again, just kind of the angle and all the vertebrae there. So I like to do that technique as well. And I would spend maybe 10 or 15 minutes doing some of these techniques in this area. And then what I'm going to have the patient do is we're going to go through some range of motion movements. So Kinsley in this case is going to do what's called a prone press up. So she's going to go up into a prone press up. We're going to go into a lot of extension here. So she's trying to bring her thoracic spine into extension. She's going to go up and then she'll go back down. And then I'm going to also have her do some thoracic rotation. So she's going to go in this position here, rock back on her knees, put her hand behind her head, and then go into rotation. We're going to do this to the right, all the way as far as she can. Then she's going to repeat this to the left, and she'll do this for several repetitions each way, just to kind of go into that new range that we've been creating with those mobilizations. Again, I always follow up our mobilizations or manual therapy techniques with some sort of movement, exercise or movement pattern, something that we need to do to kind of keep that new range of motion that we've went through throughout the treatment session. Hope this video helps, guys, and thanks so much for watching.